Okay. Um, Now think about what mental health services were missing when you needed them the most. Does anyone want to share an example of a service that might have been missing for themselves or for someone they care about when it was most needed?
I'll share.
Thank you. Go ahead.
Um, right now I'm been in a search for over a year and a half for a mental health specialist who will support me with my own personal values. And it's been very difficult. I'm a war veteran, and right now I'm seeking help even outside of is not helpful.
Okay.
Thank you for serving.
Is there anyone else who would like to share an example of a service that was missing when they needed it most? Lucy, do you have your hand up?
Yes.
Go ahead.
Hi. I had occasion to look for services for my sister. This was some years ago, and she was very she had complex medical issues, and what we needed at the time was some home health, home mental health services, somebody who would actually come to her because she wasn't always capable of getting out to go to the appointments. So that was something that I felt would have really made a difference.
Mhm. Okay. The third question, have you ever been told that you were ineligible for a service that you needed? Has this applied to anybody here that they'd like to share?
I would like to share.
Go ahead.
Yeah, so I am an MSW's intern at CCA, and I have decided to get my own therapist, and I was working with them for a little bit, doing some heavy EMDR, and that's like, a very skilled practice, and it's not many do it where I live and with my insurance. And after some time, she wasn't accepting my insurance anymore, and I haven't been able to find another female therapist that does EMDR in my area that takes my insurance. So that's been something that's been difficult, and it seems to be something that I do need as service. So
Okay. These examples of services that we're missing or that we can't access help to illustrate why budgets need to be strengthened in order to fill in those gaps and help people to get the best services for what they really need. So now we're going to talk a little bit about what we mean by mental health budgets, and then we'll start to pull these pieces together. Okay, I want to start off by a statement of principle. NAMI as an organization believes that all budgets should fund the mental health services and supports that help people to get the help they need. And before we go further, I'm going to just define what we mean by the services and supports. When we talk about services and supports, we're talking about a wide range of treatments, interventions, and other recovery supports that help people to live successfully. This could include things such as supportive housing, crisis response, stabilization, therapy, case management, peer support services, medications, and much more. And these services and supports fall into 4 categories, which you can see in our pie chart here. Outpatient care, such as therapy and case management, day programs, inpatient care, like long and short-term inpatient care at a hospital or similar facility, crisis care, like crisis response and crisis stabilization, and social support, such as supportive housing. So when we say that budgets should fund the mental health services and supports that get people the help they need, we're talking about funding the various types of services to improve the lives of people with mental health conditions in all 4 of these areas. While NAMI advocates for mental health funding, there are many different interests that are also competing for that same pot of money, both locally and at state and federal levels. Policymakers have to find a way to fund all aspects of government mental health services, infrastructure, public education, pensions, law enforcement, and a whole host of other services and systems. If policymakers increase spending in one area, then they of course have to cut another area of spending or increase the revenue. And policymakers must make tough choices in order to meet a wide range of community needs. Our job as advocates is to share how important mental health care is to the lives of at least 1 in 5 people in our state who are affected directly by mental health conditions, as well as their families and communities. And it would be difficult enough if those were the only considerations that policymakers had to think about, but it's much more complicated than that. We mentioned before that policymaker decisions can disrupt communities' budgets and what's available, but changes in the economy can also impact those budgets. And it's predictable that the economy grows and shrinks and shrinks and grows. And states know this, which is why a lot of states have basically a rainy day fund for this purpose. Now, why is that important? That's important because mental illness does not go away in a down economy. And if the pandemic taught us nothing else, it's that there was a rising need for mental health services. When the economy gets worse, more people lose their jobs, and therefore they also would lose any employer-sponsored health insurance they may have. When people lose their jobs and insurance, they also tend to use more public services like Medicaid, state unemployment benefits, and things like the Supplemental Nutrition Assistance Program, as we know, is SNAP. The government also loses some of its tax revenue because people are not working, and that's what helps to pay for the programs that are in the budget. So when people use more public services and there's less tax revenue, budgets are stretched thinner and policymakers have to make more cuts to the budget, services, and payments, or again, collect new forms of revenue. Even under the best case scenarios, funding is at risk during economic downturns. Mental health services are often one of the first areas to be cut, and of course do not deserve to be. That's where your advocacy is important, but to be most effective, it helps to understand those funding streams and the budget process, which might be confusing, but it doesn't have to be. So, the mental health services that you, your family members, clients, and community receive are funded at all different levels of government. And before getting into the state budget process, it would be helpful to cover just a few of the other ways that federal governments and local governments help to fund mental health services. Okay, when does the federal government pay for mental health services directly? There are a couple of specific cases. There are some military and veterans mental health care and Medicare, which is not to be confused with Medicaid. Medicare is a 100% federal program that does not only cover elderly Americans, it also covers millions of people who have disabilities, including people who have severe mental illness. The federal government also provides funding to states, local governments, and nonprofits. And here on the screen are some examples of that. The Departments of Health and Human Services at the federal level, commonly referred to as HHS, they provide roughly half the funding for Medicaid, which covers many mental health services and supports, and is actually one of the largest payers of mental health care in the country. The Substance Abuse and Mental Health Services Administration, or SAMHSA, provides community mental health block grants, which is another notable source of funding that covers important services and supports that might not be covered by Medicaid, such as first episode psychosis programs and people who are uninsured or underinsured. Under the Department of Justice, or DOJ, there is grant funding for criminal justice mental health initiatives, such as mental health courts and training for crisis intervention teams, or CIT. We have a CIT program here in Rhode Island. The Department of Housing and Urban Development, or HUD, provides funding for homelessness programs and affordable housing for people with mental illness. Now, NAMI at the national level, their office fights hard for federal funding, and you can sign up to be included in those federal advocacy alerts if you're interested at NAMI.org. But a significant amount of the funding happens most at the state or local level, which is where we can have a major impact. At the local level, some municipalities fund mental health services using their own budget. For example, a county government may have a Department of Mental Health, which provides mental health services. That's not often seen in the state of Rhode Island, largely because of the way that our local governments are made up, and largely just because of the programs that we already have available at the state and federal level. But There are some, and one such example is the Healthy Communities Program out of the city of Providence, which is for mental and behavioral health services, and that's funded at the city level. Funding can also come from foundations and grants, which oftentimes help communities to provide additional services. And while this funding can be helpful, it is usually short-term, it is usually project or program specific, and therefore does not create a steady funding stream or what we call sustainability. For the purposes of this training, we are going to concentrate most on the state budget process. So at the state level, most mental health services are funded by Medicaid agency and a state mental health agency, which could go by different names in different states. For the purposes of the state of Rhode Island, we have BHDDH, which is equivalent to the Department of Mental Health or Department of Behavioral Health in other states. We have the Department of Health. We have the Department of Human Resources. As Karen brought to my attention earlier this week when we did this training the first time, there are also funding streams under things like housing, corrections, and education. So you might be fighting for advocacy funding in multiple areas, not only in health or mental health. So keep that in mind. The budget process is a cycle, and it's important to understand it in order to know when we should do all of the concentration of our advocacy work. State budgets are passed every year or every other year. In Rhode Island, it's annually. And the budget covers a set time period, or what we call a fiscal year. Usually the fiscal year does not align with a regular calendar year. Many states have a fiscal year that runs July 1st through June 30th, which is the case in Rhode Island. I do have a handout in the packet that you're going to receive after this training that has a listing of the budget cycles for every state. So if you're helping to do advocacy for a loved one elsewhere or for yourself, if you happen to move out of Rhode Island, you'll have that information available to you as well. By the time the budget comes out, the framework is already there and it's therefore harder to change. So it's helpful to have relationships with your policymakers and staff and systems before that happens. So that way you can help to proactively change the budget and to include the priorities that we want to see before it's even finalized. Work on the next budget usually begins shortly after the beginning of the fiscal year. So as I mentioned, the fiscal year starts July 30th. They're already beginning to build the budget for the following year at that time. So to help start the advocacy, we're going to go through this budget process here. Shortly after.
Beth, can I just add in? So the
Yes.
governor presented his budget to members of the Rhode Island General Assembly, our legislature, in January. And right now, members, the finance committees in both the Rhode Island House and the Rhode Island Senate are conducting hearings on different parts of the governor's proposed budget. So that's kind of where we are right now today in our process in Rhode Island.
Thank you, Karen. So shortly after the start of a new fiscal year, the state's budget office prepares guidelines for agencies, including how much money the agencies can spend and how much they need to cut, and details about the governor's priorities. Then the agencies use that information to prepare budget requests, which are submitted to the governor. The budget office reviews the requests, meets with agency staff, and holds hearings to compile budget recommendations for the governor. Then the governor takes those recommendations and works with the budget office to develop a proposal that gets presented to the legislature, usually early winter, in an address such as the State of the State. The legislature then takes the governor's budget request, reviews it, and holds hearings with different agency leaders. Then typically each chamber of the legislature, so both the House and the Senate, pass their own versions of the budget. A conference committee of legislators from each chamber is appointed to resolve the differences, and then the full legislatures approve that budget. Then the governor gets the legislature's budget and can choose to sign it into law or to veto the budget, sending it back to the legislature. Ultimately, the budget must be approved by the legislature and signed by the governor in order to fund programs and services such as mental health care. So, seeing this process, where in the budget process do you see opportunities for advocacy? Anyone?
I can weigh in.
Go for it, Karen.
Well, You can meet with the individual agencies as they are developing their budget requests to the governor. So like, for instance, we could collectively meet with Buddha or with Medicaid or with DHS or the Department of Ed as they are drafting up their budget request that goes to the governor. The next opportunity would be to meet with the governor and his staff or his staff to advocate for including things that we care about in his proposal. And then the next opportunity is to testify at legislative hearings that are held in response to the governor's budget, and to meet with individual legislators to propose, oh, hey, the governor's budget didn't include this important money. We need it there. Can you guys put it in, kind of thing? Or, oh, the governor put this in his budget and we really need this. We support it. Please enact it, kind of thing. And so there's really multiple opportunities, I think, for advocacy in this process.
Absolutely. Yep. I would say the lion's share of it should be towards the top of this, because the more preemptive relationships and information distribution we can do, the better. But you're right, at every level, there's an opportunity. So let's take a deeper look into the role of the legislature. So specific committees oversee the budget process, and you just need to direct your advocacy towards the appropriate committees. There are multiple committees that work on budget specific issues. However, we're going to focus on the budget committees who pass the final budget. So in our state, we want to look at the Senate Finance Committee and the House Finance Committee largely, and as well as committees that work specifically on mental health issues. So we've covered how to get involved in the budget process, but why? Why should we be involved in this? To see the services and supports that we believe every person with a mental health condition deserves, your voice is critical in helping policymakers to understand the need and the impact of mental health funding. NAMI advocates for a wide range of policy issues, and the budget priorities include funding things such as crisis services, supportive housing programs, and early intervention, such as coordinated specialty care and first episode psychosis programs. At the same time, NAMI works to fend off threats to mental health care in budgets across the country. As discussed, mental health budgets are often unfairly the first to be cut during a difficult budget season. NAMI uses its advocates to fend off those proposals and to promote stable mental health funding. We can only achieve our priorities and protect against budget cuts when advocates like you share stories about why mental health funding is important. Karen, did you want to share here some of those specific budget priorities?
Sure. I mean, there's a number of them, and there's a number of different itemized dollar amounts in the governor's proposed budget that are under various departments. But some big ones are funding for the 988 suicide prevention line that actually wasn't in the budget, and there is a bill or bills both in the House and Senate to enact that funding in order to sustain a strong 988 line. There's a funding request for a lot of money, $22.4 million to support the state's transition to a network of certified community behavioral health clinics. That's very important because these clinics will be providing a lot of different services, including 24/7 options and youth mental health services and whatnot. It includes the funding for Eleanor Slater Hospital. And there is a request on the table that would allow the state's Medicaid program to cover mental health services that are provided to kids in schools. So those are just some examples. There's a lot of other items in the budget or that have come forward through legislative action that would impact the state budget. Is that helpful, Beth?
Thank you. Yes, it is. So the example that's in our training is something that we're not necessarily advocating for right now, but we're going to use it as a model. And you can use that same model of advocacy for any of the things Karen just mentioned, such as 988, Eleanor Slater, CCBHCs, or another matter. So today we're going to use the example of first episode psychosis programs. And any of the advocacy tools, like I said, are translatable to other issues, but this is just the example provided. So a little bit of background on what those are. Every year, roughly 100,000 youth and young adults experience a first episode of psychosis. Psychosis involves the loss of contact with reality, such as hallucinations, seeing or hearing things that others do not, or delusions, beliefs that are not based in reality. Symptoms can also include speech that does not make sense, difficulty thinking clearly, lack of self-care, withdrawal, or odd or inappropriate behavior. NAMI believes that every young person experiencing psychosis deserves to realize the promise of hope and recovery. Fortunately, early treatment provides a foundation for recovery and a full life. FEP programs use a highly effective team-based approach called Coordinated Specialty Care, or CSC, which works with young people and their families to help them reach their recovery goals. The CSC, or Coordinated Specialty Care model, includes recovery-oriented psychotherapy, case management, medication management, family support and education, supported education and employment programs, peer support services. So throughout this example in the training, I'm going to use the term FEP program for short to refer to this model. We're going to spend a few minutes looking at this example. I'm going to provide you just a little bit of like a Cliff Notes version of the example in the interest of time. So research that is conducted by the National Institute of Mental Health, or NIMH, shows that compared to typical care, people with early psychosis who participate in FEP programs experience greater improvement in their symptoms, relationships, and quality of life, are more involved in work or school, and stay in treatment for longer. The sooner people get this quality care, the greater the improvements. But despite the strong research case, funding remains a challenge for FEP programs. Thanks to advocacy efforts by NAMI and others, the Federal Mental Health Block Grant provides some money towards FEP programs in states. Unfortunately, it's not enough money to make programs readily available for everyone who needs them. Also, Medicaid plans and commercial health insurance do not typically cover the full cost of FEP programs, especially supported education and employment and outreach and engagement. And that is why state funding is vital to fully fund these programs and make them available to everyone who needs them. There is a full story in your handouts, excuse me, of a family story of budget advocacy. But again, in the interest of time, we're doing the Cliff Note version. So using this quote on the screen, with the help of my FEP clinic team, community, family, and friends, I have gotten back on track. With all of this support, I am refocused on achieving my professional goals. So Andrew, who is a young man who participated in an FEP program, shared this personal experience. And this personal experience is a powerful tool when advocating for funding. We know that it is not always easy to access mental health services, and we know what can happen when policymakers don't provide enough funding. And that's why it's important to speak up, because a personal story is your way to let people know that mental health services can, in fact, provide a path to recovery for you or for someone you care about. Research shows that stories that evoke emotion and empathy are far more powerful than facts and figures in shaping the opinions of others. Hearing real stories is one of the best ways to change how elected officials fund mental health services. And if you were in the training 2 weeks ago, we're going to reiterate a lot of valuable points in telling your story, which include that your story is always right, your lived experience has value and meaning, and you don't have to have all of the answers around an issue. Just make a clear ask of the listener. However, while your lived experience is meaningful, the way in which you tell the story affects your impact. So you want to make a difference, and we are going to go over the same tips that we used in our previous training to reinforce telling our stories specific to budget advocacy. Beginning with tip number 1 is to keep your story brief. We could all probably tell volumes about what has happened to us or our loved ones or clients, but we'll lose the listener if we spend too much time or give too many details. So we are going to aim for 90 seconds, kind of like a movie trailer where you get the highlights and then you want to hear more about it. And that's what you want to achieve with your story. Give the highlights about how funding for mental health services has made a difference in your recovery or that of someone you know, and leave the listener eager to learn more. The second tip is to motivate the listener using positive concepts like hope and recovery whenever possible. Hope is a powerful motivator for policymakers. People like to root for those who have made it through adversity, and we want to use that to our advantage. If you struggle to think of the story as hopeful, think about how better funding for the services we're advocating for would help you or others on their path to recovery. And then here's our last tip. Make an ask of your listener. This is oftentimes forgotten when people are telling their stories, but as the saying goes, if you don't ask, you don't get. Besides, policymakers want to know what you want them to do, even if they disagree with it. If you're talking to policymakers, let them know that you want their support to improve funding for mental health services and for supports for people with mental health conditions. So we just reviewed the 3 most important tips in telling your story. What do you think was the most meaningful thing that you have learned so far? Anyone?
I would say the ask, and then of course, like you said in the beginning, just kind of making sure that, you know, you're making that emotional impact that you want to make. So by keeping things brief and just really kind of getting to the point of what you needed to get to.
Definitely. Yep. Keeping it brief,
Yeah.
using the emotional impact.
I was gonna say the same thing as Amber. That was what happened in our last breakout group last time, is that we came up with the problems, but you have to figure out what is your ask? What are you asking for?
Mhm. Anyone else want to add to that? Okay, so I'm not going to go through another sample story because we've just used that brief quote about FEP programs. But what I would like you to do is take a few minutes using your story, maybe some notes you've jotted down at the beginning when we talked about what worked best for people, what the barriers were, and what was missing when they needed it most, and try to tie your story back into a budget specific request. And then we'll come back to the larger group and share. So yep, I'm still on track for time. So I'm going to give everybody, let's say 5 minutes just to make a couple of notes to themselves, and then we're going to share as a larger group. So timer starts now. I'm going to give you an extra minute or so in case you need this tool to use.
I just restarted the recording. People have been taking a few minutes to write their own stories with a specific budget ask related to it. And Beth has just posted the 7 questions that NAMI recommends people use in outlining their own story.
I'm going to give you one more minute to work on that, and then we're going to have a little bit of a brief discussion on it. Okay. So just a little chat. How did it go for everybody? Good, bad, indifferent? Anyone? What did we learn from this exercise versus for the majority who participated in the first session 2 weeks ago? How did your story differ, or what did you use about your original story in order to direct it more towards a budget request? Anyone want to share?
I was gonna say, for me, I just kind of learned this time to bullet point it. So like before it was more of like a flowing story, but like this time I just learned to kind of keep myself on track to bullet point
Mhm.
so that I'm not going on like little tangents, I guess you'd say.
That's a good tool to use. Yeah. Anyone else?
For me, I've been using data, numbers, percentage to be more clear, to show more volume, to show quantity.
Okay.
The generalized statement.
Okay. Anyone else? So using this framework, you're going to be able to tailor your story to a variety of different things. The first time that we did the exercise, we just wrote our stories in general. What is your life experience that you think is valuable for people to know in terms of needing change, wanting to make change? Now you're going to take that same story and be able to deliver it to different audiences for different requests over and over. So you already had that framework. Now we just have the budget ask in mind. What else do you think made the story effective? When we're thinking about asking for budgets, whether that be to continue to keep a level budget or to increase a budget or to create a budget for some new initiative, what do you think is most effective in telling your story? Anyone?
I know for me, it'd probably be like what works. Like when I first started, like peer support wasn't a thing. When I first joined in, like people don't really realize how new it is here in Rhode Island. So like when I did it, so like I made sure to mention that when for the things lacking, how much the peer support actually is what has led me to get to where I am today. Because without that peer support, I wouldn't have known how capable I am, as well as how valuable my voice really is.
That's great.
Yeah, that's really, I think, a powerful message to convey. If, for instance, the issue is around like even the funding for CCBHCs or funding for individual organizations that rely on that funding in order to recruit and train and put into the field the network of peer support counselors.
I agree.
I'm
Anyone
totally,
else?
I'm sorry.
Go ahead.
I'm totally agree for the peer support and parent support, so whatever that help, and also like would like to have more bilingual and the cultural competent. It's very helpful for me because I kind of like going back and forth to like number 1 to number 7. It's very powerful for the people can able to ask the question. So if the problem not solved by the number 7, we can go back to the number 1 and number 2.
That's true. I mean, there are times where we spend, I don't know how much time providing testimony or going back to the State House for various hearings or having meetings with various legislators. And it's helpful to continue to use this same model. Anyone else want to provide feedback? Colleen, you have your hand up?
Yes, I'm wondering if the story always has to be positive. When I just did this exercise, I really found the questions really helpful to keep on track. But my story is regarding trying to help my brother.
Mhm.
And it didn't end successfully, but just maybe highlights how family members need support as well, and especially when the outcome isn't a positive one. So I'm wondering how to frame a negative story to help with getting legislators to move on their policies.
So I had this question the last time I provided the training as well. And the answer is you can still use stories that don't have a positive outcome for your personal connection, whether it be your own life or in someone else's, to show what could help other people. And so that's going to draw on the emotion of the person you're speaking to, presuming it's a legislator in this case. And then you can use that emotion to say, I could not help this person, or I could not help this group of people, but we could help other people. And so using the emotion from the story that may not have a happy ending can still be a very powerful and effective basis for a story of hope for others. Let me provide you an example. So we regularly give testimony on different issues every year. I draw down on personal experience when I talk about suicide prevention efforts, as I lost a very close friend who died by suicide. And I use that example and I say, while those efforts weren't there for Mark when they were needed, we could prevent other people from becoming a statistic in the future. And taking that emotion, as long as you can, as long as you feel that you can create a story of hope for other people, I would say use that story. I think it's sometimes more powerful than a story that ends in a happy way.
I just want to share my own personal, because it took me a very long time to recover. For example, I have met with one of the counseling is young, just got out from college, and probably did not understand the language because I'm speaking second language, English, and different culture. What I didn't mention about that, and she's just kind of like concluding about okay, this is America. It's kind of shut me down. Yeah. And I said, oh, I do respect you because you are the professional, you are the doctors, and then you saying this is kind of hurt my feeling. So I just decided did not show up for the appointment, and but that's a good thing, is my strength, did not give up. And just kept saying and telling with other whoever understand me, just kind of telling the story. And I hope that's going back to her. I hope she does understand about the situation. So the thing is, do not give up.
That's a good example.
That is, and that's a kind of advocacy that can happen even non-legislatively. Like, for instance, writing your story down, explaining that in a letter to, for instance, the Rhode Island has the Psychologist Association of Rhode Island, right? The National Association of Social Workers, Rhode Island, and sharing that with them, because then they can work and urging them to do more, to recruit and help bring in a more diverse network of providers to the state. But then you can also use that story with state legislators to say, there's a need to provide student loan relief or free tuition, for instance, to a broader diversity of students that are participating, and this is a direct budget request to the state, in order to incentivize a more diverse group of students coming through the state schools programs to train counselors and licensed clinical social workers. And that's a place where some of the issues that you've articulated could be addressed, because, it would be great to have more counselors of, with a more diverse background, whether they be Southeast Asian culturally, or if they are Black, or, from a refugee background, for instance. So does that make sense? There's multiple places where you can share that story in order to help educate the existing network and to help incentivize a broadening of the network.
So just want to leave everybody with a couple of last thoughts is save your stories that you worked on, because these are going to be things that you can edit. It's a constant work in progress for any advocacy efforts. If you find yourself presented with an advocacy opportunity and you want to participate, but you're not sure about your story, feel free to send me an email and I'd be happy to work on that with you or try to provide additional tips and advice that might be useful. And with that, I am going to turn the mic over to Tara.
Thank you, Beth. So I am Tara Hayes. I'm the Family Voices Program Manager over at RIPIN, as Karen said. I am presenting you today with a little bit of information about how to, once you've created your story and crafted everything and you've looked at the issues that you're really concerned about, how to convene groups and get together with other people who have the same interests in these issues as you and want to make system change. Just a little background about myself for those who may not know. I am a peer. I am a mom of a child who is 15, who's medically fragile. Spent time in the NICU and is trach, vent, G-tube, requires some significant medical services. So I am a mom to him, so I'm a medically fragile mom, and I am also a mom to a couple of other kiddos who have experienced some behavioral health, mental health issues along the way, especially recently in regards to my oldest medical complications. We had a pretty severe hospital stay over the summer, and they had a really hard time with that. So I am on two screens. You may see my name because I'm going to share on this one and be able to see everybody on this one. So let's go to 1 second here. Okay. Share on the screen. Okay, so building partnerships to create change is where we're at today. Oh. And so we're going to start off today with two questions. The first one is, can state agencies create sustainable changes without authentic engagement of diverse stakeholders, including the families who are their intended beneficiaries and the family organizations who support them? The other question is, can stakeholders create sustainable change without the participation of the people in authority? Now, when you look at these two questions, what comes to mind to you? Do you have answers for these questions?
I would say one feeds into the other, but also without the various players, I guess you'd call it, it would kind of all fall apart, because one without the other really can't help the other, so to speak. I don't know if I'm making sense, but I hope I am.
Yes, perfect answer, Amber. Yes. So if you have just state systematic people trying to make changes and you don't get the input from stakeholders and the people who are engaging, and a lot of, I will preface this that I do say, because I work for RIPIN and my program supports families with kids with special needs, we do reference and say families a lot, but it can be broadened to say individuals, people with disabilities, people with mental health or substance use disorders. So it can be broadened. But yes, if you are trying to create a program, but you don't have the input from the people who are going to access the program, you're probably not creating a very viable program, something that's going to last, right? And if you're the one who accesses the program and you're trying to make the change, but the policymakers and the people who pay for it aren't involved in the process, it's probably not going to work because you don't have that decision-making process to be involved. So there's some challenges, correct? And so those challenges are that policy alone cannot make change. So just because there's legislation in place or there's a law or a rule put in place, it's not only going to work. It's not always going to work. There has to be, all people involved. Another challenge would be differing motivations of the key players. So the policymakers and the families may have two different ideas of what they want out of things. And if they don't get on the same page, things might be disconnected. Leaders may believe that they're already engaging stakeholders, and we hear this all the time, that, oh, well, they asked to have family input, but they came to us at the focus group and they already had a plan developed and a plan designed, and they just wanted us to give them their feedback. And when we told them we didn't really think it was going to work because of A, B, and C, they were like, oh, well, we already have this in process. And that's a change that we're not going to really be able to make because it's already been, worked on and things like that. So not including those who are going to access the program from the beginning tends to make things very challenging, and the system may not work. It's also difficult to address systematic deficits while mobilizing widespread support. So how do you address those issues that are within, say, Health Source Rhode Island, or issues within any of the behavioral health service provider issues, while mobilizing at the same time, getting a bunch of people to support it? You need to kind of have that supporting in place before you try to change the system. And then capacity building, it usually focuses solely on technical elements, and it doesn't have that human approach into it. And when I talk about technical elements, we do have I do have a handout that I can pull up to show you guys what we mean. So it's, technical elements are more like what the issue is, how do we find, who's going to support it? Do we need to develop a mission or a vision? Is there engagement? Is there a work scope and actionable goals? But the human element is not just what has to be like put into place and put into law, but it's how it's going to be used by those who need to access it. So are all perspectives being considered? Is there languages that that we have to make sure that everything's translated to? And a lot of times what we do at RIPIN, and especially within my team, I have a team of, it's myself and 3 others, and 2 of my staff are bilingual. So when we're developing resources, we develop it together and make sure that it's at the best language and most clear, understandable language in English before we translate it to Spanish, because if we write it in English and then translate it in Spanish later, there may need to be some clarifications and things changed based on how the language translates, right? And so you can't just have all those technical elements. You really need to have the personal touch, because if you don't, you're not going to understand what the issues are with people who are accessing the programs and services. I will get rid of that. Okay. So leading by convening is the name of this best practice training. But it's very involved and very large. So I kind of took a snippet of some of these slides combined with some of our other slides that we had in another training to make this the most meaningful presentation for your needs. And so when we say leading by convening, we mean that, you're bringing people together and organizations together. You're building partnerships so that you have all players at the table. We convene the stakeholders to discover why it's important and how it will improve the practice. So you learn, like, what are the issues with the way things are being accessed now? What are the issues with not having service providers and not having access to telehealth and things like that? And then we meet people where they're at on the issue. So some people may be at the point where they've been listening to this for years, they're ready to go and have their voice heard at the State House. But other people may just want to meet as a smaller committee with other groups to learn about, what is going on in the state, and can they be a part of some advisory committee to help support change within the system at that level. And then others, you may just want to have that one-to-one conversation and help support navigate the systems better. And then we also, mean by leading by convening means to translate those complex challenges into ways that stakeholders can contribute. So it may not be that the stakeholder is going to help rewrite the law, but they're going to help the policymaker understand what needs to happen so that the law or regulation can be rewritten so that they can have better access or better services. So we also mean by this that we want to help people lead in place, regardless of their role, position, or title. Just because you are and I shouldn't say just a family member, because that's like what we always used to hear, oh, you're just a parent, you're just this. But that really holds a lot of weight. When you have that lived experience, especially now, I've been at RIPIN for 12 years now, and coming in, it was, oh, I'm not ready to be, to be a leader, or I'm not ready to convene people. But little by little, you learn that your lived experience can hold a lot more weight than somebody who has a college degree, because you've been there, you've seen it, you're living it, and that helps you to understand exactly what's going on with the system, things that other policymakers may not know because you're in the throes of it and you're connecting with others who may be in the throes of it. So you don't have to be a policymaker or a professional to be able to lead groups. You just have to have the want and the people to get together and be able to work together to do that. We also mean that we want to create new knowledge together. So taking what everybody in the group knows at whatever level they're at, and creating that open knowledge and open learning from each other, so you can understand where everybody's coming from and what services and supports may need to be changed or worked on together. And that helps to solve those complex issues that need the various perspectives to find solutions, right? And then you also need to build a personal commitment to working in this way, because inclusive work is definitely more sustainable work. If you're working kind of against each other, it's not necessarily going to be sustainable, because not everybody's on the same page, and everybody needs to be on the same page to make sure that everything, that whatever you're working on gets to that, raises to that higher level and is put in place with all perspectives and all individuals involved. Collaborative leadership. So just want to make sure that I'm not missing. Yeah. So collaborative leadership is something that we've been working on for a very long time. We do have a handout that goes along with this that I will share. Screen over here for a second. See behind here. Okay. So shared decision making, and this is a process that's been going on for a really long time now, but it's becoming better known. And when you have a collaborative leadership, you have shared goals, shared responsibilities, you make sure that everyone's voice counts. You have that cultural reciprocity. So you're taking into account others' feelings and beliefs and needs, and whether that has to do with their diagnosis or their race or their ethnicity, or making sure that you're not setting up meetings that are on days of either holy days or days of service or whatnot. And then we also need to make sure that there's mutual learning. Like I discussed, you're learning from each other, you're open to new ideas. You have that ongoing communication and networking, and it helps to create that atmosphere where thoughts and perspectives can be openly shared. So if you're looking at these areas of shared decision-making, and you see it's the shared vision, the representation, equal partners, collaboration, shared responsibility, information sharing, and then producing results. Now, what do you guys think would happen around that common goal if any one of these principles are missing? And you can pick a specific principle or just in general, but how would things work if any of these pieces were missing? Don't everybody speak at once.
Yep, you
I
can
would
just
say-
speak up or raise your hand.
I was gonna say, again, it would all fall apart because, for example, if there's, going like with the shared vision as an example, you know, if not everyone shares the same vision and you're competing for different ideas, you know, it kind of frays and makes things more difficult. So you really kind of need everybody to be on the same page, working as one.
Exactly. And I mean, things could progress if some of this stuff isn't in place, but you're not going to get the best version of what you're looking for, right? You know, say the information sharing is lacking. So the people who are the professionals or the policymakers at the table aren't completely relaying to the individuals or the family members what they are looking to put in place, and vice versa. The family members might not feel comfortable speaking up and saying, this is something that's really not working. We really need to figure out how to do this better. If that information sharing isn't going across the board, then not everybody's going to know what the issues are or what the steps are that are being put in place. So it may work, it may happen, but it won't happen in a way that's going to be a viable, good, valued program. Does anybody else have any thoughts on that?
Tara, I just really like this because this particular chart and a deeper understanding of how we can work collaboratively to really move things forward, you know? And I think it's a really useful tool. And I know it's hard.
Yeah.
Really hard work, and making sure that each of these components are as strong as they can be really challenging. And it kind of requires having a passionate person at the center of this to hold the pieces together,
right?
Help coordinate. And I think that's sometimes where individual advocates really find their strength is in helping to serve that role or support that role anyway.
Yeah, and we use this handout also with our right question workshop, and helping others to you know, ask the right questions and typically with that we're talking about like a healthcare meeting, like maybe a healthcare transition meeting, or even like an IEP meeting with your child. Like, and that's the common goal, right? The common goal is the child, or, you know, the service that needs to happen for the child. And if you can get everyone to come together around that common goal, then even though we're going to talk about some of this in the following slides, but some of those challenges that might be happening, if you keep grounding yourself in that common goal, they tend to work themselves out. And then, you know, it comes together a little bit easier. So thank you. So convening, right? It's not just about a meeting. It's not just about being a facilitator, but it's really about the beginning of a relationship and focusing on that practice change. You're building partnerships between families and individuals and professionals and policymakers, and helping others to see other perspectives. And as we say, you know, Rhode Island being the smallest state, it's not that hard. You're not so far removed, no matter where you are in the state, you're not so far removed from those who are in poverty, or those who suffer from food insecurity or lack of housing and things like that. So it's happening right in our back doors. And it's very hard for others to say, well, that's not happening in my neighborhood, because your neighborhood isn't too far from somewhere, you know, right down the block where where these things are happening. And so now we think about engagement, right? And engagement really is the heart of the solution. Like, you have to have engagement in order to make sure that things happen appropriately and correctly. And so habits that have to happen in these interactions are coalescing around issues, which means getting together, convening, ensuring relevant participation, making sure the right people are at the table, and then doing the work together, being collaborative, talking to each other, and really having that transparency as the system is being developed or is changing. So I want everybody to take a look at this slide. And it's kind of a fun slide, right? You think different perspectives. So what do you see? What do you notice about all the people in these slides? Does anybody see a commonality between anybody in these slides? They're in silos. Yep, that's right, Lucy.
They're all blindfolded.
They're all blindfolded. Thank you, Colleen. And so when you're blindfolded, you, number one, you don't necessarily know what's going on around you, right? You're siloed, you're focusing solely on where you are. So depending on your own background and your experiences, that's how you are looking at an issue, right? Or at something, at a picture, at whatever. And so when you don't know others' experiences and other issues, you just focus on what you know, right? You only know what you know. So they're all wearing blindfolds. They're all touching a different part of the elephant. Somebody's saying, oh, his trunk is they're saying it's a snake because they don't know it's a trunk. They don't know it's an elephant. The leg, it's a tree. The body, it's a wall. So they're all looking at just these one little parts of the elephant. And you can't, when you're looking at just that one part, you don't know the entire problem. You don't know what the root cause is. You don't know how to address any changes because you're only looking at this one little part. And so why do people come together around an issue? What brings people together around issues? What are some reasons why you all came to this training?
To enact change.
To enact change. Awesome.
To either start or improve something.
Get everybody in the same page.
To have everybody on the same page.
They have common interests.
Common interest. That's kind of the word I was looking for, Jonathan, because there is commonality among things, right? You're all around a common cause. So it may be that there is the same needs. It may be that there's the same purpose, or it may be, or it may be that there's the same action that wants to be taken, right? So it's because you all have an interest in mental and behavioral health and services and improving them in the state. That's why we're all here today, right? So, so when people come together and have these common issues, they call that coalescing around the issue, gathering around the issue and working together to make change. So we're going to go back to our elephant. And we see that, you know, if we are able to, now they still all have the blindfold, that same picture, but if you can understand, if you take that blindfold off and you look at the different perspectives, you're like, oh, okay, so that's why you thought it was a tree, or that's why you thought it was a snake. So when you hear from other people's perspectives, you can occasionally like cross those boundaries and start to understand why people think the way they do, or are coming at an issue the way they are. And this can be, you know, things are complex. A lot of things that we don't see are interconnected. These are all pieces of an elephant. So, you know, when we talk about improving behavioral health services in the state, there's like so many things that need to happen, right? There's the increased reimbursement rates. There's better, you know, insurance, better providing of insurance coverage. There's, you know, there's needs to be better access to culturally competent providers and all this stuff. And so it's all interconnected. And even though we can, it takes a long time to get there, and hopefully like we're not improving small things at a time. Hopefully if we can improve a number of different things at a time, it'll come together better. But it's a long process, as many of us have seen in this state. It's a very long process to get from A to B without, like, you know, some issues coming along the way. So even though things may appear different to different people, it's still gonna if you can come together, you can still make a good change. But again, where it says boundary crossing, sometimes you really have to say, all right, like my personal and professional, especially like in the role that I'm in as a peer, a peer, you have those commonalities with other people, and it's hard to sometimes separate the personal from the professional when you've struggled through the same things and you're finding the same challenges as you're trying to access services for yourself or your family. And sometimes from the professional side, they're getting, they're getting told by their superiors, well, we can't do this because we don't have the money to do this, or there isn't, enough workforce to do this. So we can't put these things in place. But sometimes you have to kind of look at the big picture and say, I know there's all these technical elements, but the human aspect is saying that things need to change and somehow we need to make this happen. And so that's why telling your story and having that personal piece of it is so important to being able to connect to others. So we're going to do a activity now, and it's called 4 Simple Questions. There's a number of different activities that come through leading by convening and through this one module about coalescing around issues. But this is the one we're going to focus on, the 4 simple questions. And then when you get your resources after this, this training, there'll be links to the other activities as well for you to look at on your own. So 4 simple questions, and I'm going to put, where am I sharing? Oh yeah, I'm going to put in the chat a file that you can download, and that will help to guide you through this activity.
And Tara, you're putting that in the chat so people can just click it and download it, because you're going to put us into breakout groups, right?
Yes, sorry. Yes, thank you, Karen. So I'm going to break us up into 4 different rooms, and I have 4 different topics that we're going to focus on. And so here, I'm going to put those in the chat as well. So depending on what room you're in.
Yes.
It will be, oh, did I not share that yet? Oh, okay. I shared it twice. It's the same document, even though it's named differently. And so here are the rooms. So when we go into the breakout rooms, though, this chat is not going to be visible. So I'm going to just randomly break you out into rooms, but we'll talk about it for a second first. So room 1 is the 4 simple questions. Let's actually go here first. 4 simple questions activity gives you these 4 simple questions. Who cares about the issue and why? What work is already underway around the issue? What shared work could unite us? And how can we deepen our connections? So thinking about who you know that cares about the issue, who you know that's already doing the work, or what they're doing. Are they having meetings? Are they having legislation? Are they having any Facebook Live events? Anything like that? Is there shared work that could unite us on that issue? And maybe it's a resource guide, or it's a Facebook page, or it's a meeting coming up, or something like that. And then how can we deepen our connections is really about how we can take what we want to work on and support other groups, and then get others to support us in helping the work move forward. So I will now stop sharing, and I will put us into breakout rooms.
And Tara, you're breaking out the rooms with a particular focus area on current.
Right. So,
right.
The room 1 is going to be about increasing reimbursement rates. So these are all areas of concern when it comes to mental and behavioral health services. So room 1, you're talking about increasing reimbursement rates, who's doing it, what's being done, etc. Room 2, the lack of transitional services. So when you're in, say, an inpatient, or you're going to counseling every single week or twice a week, and you need to step down from that, why is, like, what, are there enough services for people? Like, I know friends who have children in Bradley, and when they get out, there's not a lot of different step down options for them to have services and supports for their kids before they transition home or as they transition home. Room 3 is going to be about adequate funding, and that's for certified community behavioral health centers and the 988 suicide hotline in Rhode Island. And then room 4 is about access to culturally appropriate providers. So those who may speak the same language as you, have the same cultural background as you. And I even thought about this in the last, when we did the training on Monday night, that it also could be that they have had the same diagnosis as you, or have suffered through the same mental health issues that you have. So does anybody have any questions before we go?
Yes, I do.
Okay.
So I was actually just typing this in a message, but my apologies. I had to take a phone call just now. So am I in a breakout room?
I'm going to assign everyone to a breakout room now.
Okay, thank you.
You're welcome, no problem. And so hopefully you've been able to download that 4 simple questions, or somebody in your group has, and can work on that, and that you've taken down, and that you know what each room is for. And if you have any questions, you can always send me a message. Because I'm just going to divide them up automatically. So, and we'll have about 10 minutes. So we'll come back together at 1:07. All right, here we go. So I'm going to go back to sharing my screen, and we only have 20 minutes. So the next activity, I just want to do kind of as a whole group. So these are quotes that that are given to us in the Leading by Convening training, but I've weeded them down a little bit. So there's 8 here, I think. Yes. And so I want you guys to take a look at these quotes. Pick one that resonates with you, and think about, we'll take 5 minutes to do this. Think about what it means to you, and why it means something in the work that you do. And we'll have a few people share out after. So we'll take till 1:17. And it's a little self-assessment. Oops, sorry, Karen. It's like a self-assessment of how you manage and handle conflict. So I always like to take it every time when we do this, like the training in person and stuff, and we do it, I'll always give myself a refresher, just because it's nice to see if I'm still at the same area, or if I'm doing any better. We want to make sure that we will work together. What work has to be done, who can doing it, why would you want to do it? Obviously, if you have a passion around it, that's why you want to help to support the team. But the biggest thing from this slide is, how do we change the problem, change it from us versus them to us versus the problem? So making sure that it's not like the families versus the professionals, or the stakeholders versus the policymakers. It's the group, the advocacy group, against the problem, and solving that problem, working to solve that problem. These are characteristics of a good facilitator. So when you do have meet as a group, these are things that you want to try to make sure that that are happening. And there's a handout that goes with this as well. And this activity I really like. It's getting to know your style, and it's called the MAPS activity. And everyone will get this activity as well. And some of these activities, they come with rules and instructions of how to do it, because then you can take them and do them with your groups as well, and kind of have those like skill building, team building kind of sessions once you get to know each other as a group, and to help you get to know each other as a group. And so it really addresses, who you are and why you're invested in this issue, but also like, what are your hopes and dreams for the issue, as well as what are your fears around bringing people together around the issue. And it helps to kind of put those fears a little bit at ease, because if you state it out loud and you kind of work through it, then once you get to actually bringing people together around the meeting, you may see that those fears aren't really fears that you needed to worry about, or that other people have those fears as well. There's another handout about creating SMART goals. So these are things when you bring people together and you have a group, you want to make sure that you have a goal in mind and things that you want to get to. And so, you know, this is just a way for you to develop goals for the group, but also hold you accountable towards those goals because they're time bound and they're very specific. And so there's a handout that addresses that as well. And an evaluation. You know, once in a while, you always want to, you know, do a survey or a quick check-in, and it can be formal or informal with your group, but just to make sure that you guys are on track for what you're looking to do, and that you have, you know, that you're not only getting that constructive criticism, but you're sharing that out with the group and how you can address the issues that are brought up in the constructive criticism. And here's just some resources that you guys, that has the links to the portions of the training that are online, and the resources. And with that, 6 minutes left, I will turn it back to Karen to go over the final things. And yes, you guys will be getting this presentation to reference. I will stop sharing.
Thanks, Tara. I wanted to leave that answer to you because I wasn't sure if in the handouts that you gave me to send to everybody, if this PowerPoint was a part of it.
Yes, it's in as a PDF, but the link should still be active.
Okay, perfect. So in wrapping up, first and foremost, and I'm going to put it in the chat right now, is my hope that you all will evaluate us. We want to make sure that this workshop is useful and effective for everybody, and your input is critical to helping make that happen. And, you know, be honest with us. And if you have specific suggestions, there is opportunity in that survey form. I put the link in the chat. My hope is that you'll all click that link right now. And when we hang up today, you'll go in and complete the survey right away. So that's that request. Also, I wanted to highlight that there are some current advocacy opportunities. And I may be reaching out to some of you individually too. Like, for instance, Jonathan, it would be awesome to interview you on Zoom maybe about the work that peer support counselors are doing within the system. And we could share that through like our Mental Health Association newsletter. All the elected leaders are on that newsletter list, along with about 4,000 people statewide. So how awesome for people to hear about the work you guys are doing. That's one way to deepen connection, right? So I may be in touch with you, Jonathan, but other opportunities are, I want to put this up on your calendar now. I mentioned it in part 1 too, but save the date, April 27th at the State House. It is a rally and kickoff for May is Mental Health Month, 2 p.m. to 4 p.m. This is a chance for us all to come together up at the State House, show power in numbers. And it's a chance, there will be people there to help individuals go in and talk to their own elected leaders, but also it's a chance for groups. Like, there's a lot of peer support counselors and community health workers here, like going to leadership in the House and in the Senate together to say, we work in the field, we work in the community, please, you know, act on these important issues. And there'll be a handout and all that kind of stuff. So it's a real chance for us to show and have an impact up at the State House. So April 27th from 2 to 4, take the survey. And the Mental Health Association has set up a story bank. It's a place where you can go and share your story in whatever depth you personally choose to help guide the policymaking work that the Mental Health Association is doing. This is our primary scope of work, is we are policy wonks. We don't provide direct service in the community. We often host focus groups. We often host workshops and educational components like this, but Your sharing your story with us will help inform the policy work that we do. And also, only with your express permission, is a place where we could interject a quote or a personal story into conversations, because we're at the State House. Lori Marie Pichota, our director, is at the State House almost every day of the week. It gives her a chance to say, you know, here's what we're hearing from peer support counselors, or here's what we're hearing from patients trying to access testing and evaluation for their children who are experiencing obstacles in school. Whatever the case may be, it's an opportunity to interject your story into the day-to-day conversations that are happening up at the State House. So I put a link to that story bank in the chat. I hope you use it. Feel free to share that with other people. I'll include this in the follow-up email. And there's also a hard copy form for the story bank if people are more comfortable that way, you know, doing it, participating in that way. And then you will get periodic emails as hearings happen up at the State House. I will forward information on that out, because if it's relevant, like for the CCBHC funding, you may all want to submit testimony. You may want to come to the State House, testify in person, or you also have the chance to testify in writing if you're not able to get to the State House, or you're not comfortable going up to the State House. And anytime I send out an alert with information about a hearing or an event or an action that's happening that I think you might be interested in, if you have questions or anything, don't ever hesitate to pop me an email. I think that's it. My promise to you all is to send you the follow-up with the materials and everything from today. If it isn't by the end of the day today, it'll be tomorrow. Sometimes the processing of the video takes time. The other day it took like 4 hours. So,
Oh my gosh.
depending on how long that takes. I don't do the processing. It's just like
Yeah.
the
Right.
amount of time that it takes for Zoom to do it.
Yeah.
Depending on how long that takes, I want to include the link to the recording for today to include. So you will get that follow-up email from me either end of day today or first half of tomorrow.
That's great. And Beth and I both put our emails in the chat. If anybody wants to connect with us individually, we're happy to support any of you with any questions or any work that you're trying to do around these issues as well.